Dr. Vince here, physical therapist. You can find me at movementthinker.org. We've covered this video series of how the shoulder moves. The muscles on the back side of the body will do all of your pullers. The muscles on the front side of your body will do all of the pushers. It's a very gross way and generic way of watering this down, but it's the easy way of watering this down because I'm going to discuss the difference between pulling and pushing in another video. What we're going to look at now is called vertical pushing. It's commonly known in the gym as an overhead press. There's multiple versions of it, which is why I just keep it at vertical pushing. Okay, so to get into like some of the details of this, you can do a traditional overhead press. You can do what's called an Arnold press and change your wrist positions. Small details. What really matters is getting your arm overhead under a little bit of load. Load being weight, could be gravity with a dumbbell, it could be a band, it could be a machine. I don't care how you do the motion, I just care that you do the motion. Okay? Most important thing. But getting back to this one is a little bit trickier for a lot of people because some people have pain when they go overhead. Do not push through pain when doing these exercises. You may feel a muscle burning the more you do, but if you feel a sharp pain in your joint, please don't do this. Go find somebody who understands how to treat shoulders and how to treat pain before you do this. If you don't have full range of motion, meaning you can't get your bicep to touch your ear at least without tucking your head down to get it there, right? If you can keep yourself in a tall posture and get your bicep to touch your ear, this motion is going to be relatively safe for you. If you can't do that, please don't do this. Go find somebody who can help you improve your range of motion and figure out why you have that issue to begin with. So now, we're going to cover vertical pushing. Okay, you can use a band. I'm going to use a band to start off with. You can step on the band. It's very simple. Hold on to the other end. Elbow starts off down at your side. You're going to go 1, 2, 3, 4. 1, 2, 3, 4. I want to cover some of the stuff that you'll see, some misnomers, okay, with this exercise. If you're a heavy gym goer, you may see people do their overhead press like this. They start off at their forehead and they push it overhead and they bring it back down. All right, that's not very. It's not uncommon to see. It's very common to see in the gym. And part of that, and I want to cover this because as a power lifter, this is something that we would frequently do. You can load the muscles a lot more. Okay, so you can push a lot more weight if you're only bringing it down to your forehead versus taking it all the way down to your shoulder. Okay, because it shrinks the range of motion, it makes it a lot easier for you to go heavier. That's not what we want. Okay, that's not what I want when I'm trying to teach people to move through a full pain-free range of motion in all directions. We want to make sure that you have the strength to bring it all the way down to your shoulder and to take it all the way back up overhead. Some people say, well, it can cause impingement when you bring it down to your shoulder level. You can tear muscles when you do this. People, that's all mythical, okay? And for me, that's hearsay because you should have strength through your full range of motion of every joint. And if you don't have the strength, we have to figure out why, and that's where you go seek a qualified person to figure out why you're having those issues. But again, you can use a band, bring it all the way down to where your thumb is essentially touching your shoulder, and then push it back up, 4 seconds down, 4 seconds up. You can do it with a band. You can do it with dumbbells, okay? Very light dumbbells. Doesn't matter the weight, it only matters that you do it. Again, starting off from shoulder height, press overhead, 1, 2, 3, 4. 1, 2, 3, 4. There is a difference if you do 2 dumbbells at the same time versus if you do 1 dumbbell at the same time. And it's small, but there's details. I mostly prefer to do 1 arm at a time because it challenges your trunk muscles a little bit differently than doing them 2 at a time. But I can understand doing 2 at a time for time's sake, right? And so when you take the weight overhead, you're changing the lever, you're changing how long your arm is away from your body. From here, it's very close. From here, it's very far. The further your arm is away from your body, the more it affects your trunk, okay? And so if the weight is on the right side of my body, it's trying to pull me down this way, which means that my left-sided trunk muscles have to work harder. If the weight is here, the left-sided trunk muscles don't have to work as hard as when it's overhead. And so that is why I prefer to use 1 dumbbell instead of 2. The same concepts apply 4 seconds down, 4 seconds up. Again, if you cannot get your arm overhead, you should not be doing this yet. Go see somebody who can help figure out why you can't get your arm overhead. Move well, live well. Move better, live better. Thanks for watching.